and of course for joining us for today's session as well. I'm Rachel Hammond. I chair the iPHD Governing Board, which oversees the iPHD project. I am the Commissioner of Health's designee. In my role at the department, I'm the Chief Ethics and Data Privacy Officer. So in the board's oversight of the iPHD project, the board will be responsible to review and approve all of the research applications from researchers looking to access data in the iPHD project. So your expert review, the members of the Research Advisory Committee, the RAC, is really going to give us invaluable information to know whether those will be appropriate applications to approve or any particular issues that will arise. You're going to be looking at things like the applicant's qualifications, the scientific merit of the application, and the alignment of the proposed research project with the statutorily articulated purpose of the iPHD and the research priorities. And we'll get into some of that a little bit later. So we're really grateful for your participation on the RAC. This is a really exciting project, and we're so excited to be to this point where we're having an orientation for RAC members. We're going to get into just brief introductions before I turn it over to my colleagues at Rutgers to introduce themselves and then carry on with the presentation. So if you could, Oliver, would you mind taking down the presentation so I can see everyone who's in the meeting just for a couple minutes. And I'll just go through everyone's names and ask you, and forgive any mispronunciations in advance, please. Just please tell us your name, organization, job title, and anything else you'd like to share relative to your participation on the RAC. So we'll start with Minna.
Hi, I'm Minna Silverberg. I am a faculty member in the Division of Community Health at Duke in the medical school, where I also serve as the director of our Community Engaged Research Initiative for CTSI. And as mentioned, when a few of you were on, I years ago worked at the Center for State Health Policy.
Thank you. Thank you for joining us. Very nice to meet you. Sarah?
Hi, everyone. I am Sarah Allred. I am an associate professor of psychology at Rutgers Camden. And until recently, I was the director of the Senator Walter Rand Institute for Public Affairs at Rutgers Camden, but I have now moved back full time into research and teaching, which I'm very excited about. And I am happy to be involved on this. And I'm excited to review these proposals. It's a great project.
Thank you, Sarah. Perfect timing for us, for you to participate on the RAC. Wonderful. Ed?
Hi, good afternoon, everybody. Ed Lifshitz. I'm Medical Director for the Communicable Disease Service at the New Jersey Department of Health, as the background would suggest. And happy to be joining you as well. Thank you.
Thanks, Ed. Henry?
Henry Wang. I'm a professor of emergency medicine at The Ohio State University. And my connections with New Jersey include growing up in New Jersey, going to school at Robert Wood Johnson Rutgers Medical School, and I worked with Joel Cantor previously on a funded project. So delighted to be virtually home.
One
Brilliant.
Wonderful project so long ago.
My family still lives in Metuchen, so Rutgers feels like it's right out there.
Great. Thank you, Henry. Loretta?
Hi, good afternoon. I'm Loretta Kelly. I work for the State Health Department. My unit's called the Office of Population Health. And my specialty is long-range health improvement planning. So happy to be here.
Thank you, Loretta. Soko?
Hello, hi, Soko Saraguchi. I'm a physician, general internist, and an epidemiologist. Rutgers Robert Wood Johnson Medical School professor there, and then also at the School of Public Health. My research focuses on use of population data, and also I lead a clinical research training at the medical school and other schools as well.
Fantastic, thank you. Deval?
Hi, everyone. I'm Dhaval Dev. I'm a professor of economics at Bentley University and a research associate at the National Bureau of Economic Research. I'm a health economist. Broadly, my areas of research are in program evaluation, behavioral health, child and maternal health, more recently COVID. My connections to New Jersey, I also went to school in Jersey. I collaborate with folks at Rutgers, and I've been using, in recent projects, restricted birth certificate data from Jersey. So looking forward to being part of this initiative.
Oh, fantastic. Thank you so much. Erin.
It's so fun to hear people doing all kinds of different things from all over the country. So hi, everybody. I'm Erin Zerbo, an addiction psychiatrist. I'm an associate professor at Rutgers, New Jersey Medical School, so the one in Newark, not New Brunswick. And I'm the director of a state-funded Center of Excellence in Medication-Assisted Treatment. And we run a low-barrier buprenorphine clinic, and we focus on people experiencing homelessness with histories of incarceration, et cetera. So a lot of focus on social determinants of health. And really excited to be part of this group.
Thank you so much, Erin. That's fantastic. Mark.
Hey, I'm Mark Einstein. I'm the chair of obstetrics gynecology at New Jersey Medical School and the associate dean of clinical research at New Jersey Medical School. And I'm also the associate director of our Rutgers, Princeton, and JIT Clinical Translational Science Award, and happy to help out in all aspects.
Cool, thank you. Happy to have your help. Bretta.
Hi, I'm Bretta Jackaman. I'm a research scientist at the New Jersey Department of Health's Center for Health Statistics. I do a lot of data analysis work, but I also am the strategy 2 lead for the state unintentional drug overdose reporting system, which is known as SUITRS, as part of the CDC funded overdose data to action. I'm also the principal investigator for the New Jersey Violent Death Reporting System, which is a violence surveillance system that's been in New Jersey since 2003. So I touch a lot of data. And I went to Rutgers twice, so.
Thank you so much, Bretta. So I think with the exception of our colleagues from Rutgers, we've allowed everyone an opportunity to introduce themselves. So thank you so much again for accepting the invitation to participate on the RAC and for attending the orientation today. And without further ado, I'll turn it over to my colleagues at Rutgers to do brief introductions themselves and then to get into the orientation. You want to kick it off, Joel?
Sure. Hi, everybody. Thank you so much for being here. I'm Joel Cantor. I direct the Center for State Health Policy at Rutgers, and I teach in the School of Public Policy, teach healthcare policy, and am the erstwhile leader of Rutgers part of the iPHD project. And now you'll hear from the people who are actually doing the work. Margaret.
Hi, everybody. I'm Margaret Kohler. I'm the executive director at the center. And again, adding my thanks to everybody for joining us. It's been 5 years, so to be at this point is really exciting. Oliver?
Good afternoon, everybody. My name is Oliver Lontock, and I'm a research manager here at the Center for State Health Policy.
Manisha?
Hi, everyone. I'm Manisha Agrawal. I'm a senior research analyst at the center. Nice to meet you all.
Okay.
Good afternoon, everyone. Jose Nova, Assistant Director for Data Management here at the Center, and I'll be managing data resources for the iPHD project.
Minna, do you remember Jose? I think Jose was a student when you were with us, so yeah.
Really? Wow,
Yeah.
fantastic, absolutely fantastic.
Ed?
Hi, good afternoon, everyone. Feng Yilu, go by Ed. I'm a data analyst in the center.
And I think Kate.
Hi, everyone. I'm Kate Scotto. I'm the Assistant Director of Program and Planning for the Center for State Health Policy. And I'm the lead on the financial aspects of the iPHD project, and I'm really excited for it.
Great. I think that's everybody. So why don't we get started? Oliver, if you would put the slides up. I'm just going to go through a handful of slides first to orient those who haven't heard us talk about this for the last 5 years about the iPHD. We'll fill in give you a brief overview about the project, and then I'll hand it off to Joel, and he'll talk specifically about the review process and the way that we envision this flow when we start receiving proposals, hopefully in the late spring, early summer. So I think we can go to the next slide. So the iPHD, what is the iPHD? It was enacted September 11th, 2016. So 5 years ago. Ironically, the legislation had initially stated that the iPHD was to be up and running within a year, but we've pedaled as fast as we could. So I guess we'll be bringing it in at about 5.5 years, but I think we're really almost there. The goal of the iPHD is to improve health, safety, security, and the well-being of New Jersey residents, as well as the efficiency of state government programs. Doing this by securely linking administrative data sets to support approved research projects. And we'll talk a little bit about the research priorities in a couple of minutes. The project also aims to promote population health research by New Jersey research institutions and organizations. So we will be convening a New Jersey Research Consortium. And again, part of the goal here is to highlight the wonderful work that's being done in New Jersey, as well as to use these data to continue to expand population health research in the state. We do have a governing board process that oversees the work of the iPHD, and as Rachel noted, she is the Commissioner of Health designee and the chair of our governing board. We'll talk a little bit more about the governing board and how that interdigitates with the review process. The Center for State Health Policy has been authorized in the legislation to oversee all operations of the iPHD, and we've developed a website over the last year, and there's the link if you want to pop that open and see a little bit more about the details of the project. Here is our current governing board members. There are ex officios who represent state government, Department of Health, New Jersey Department of Human Services. We have a representative from Medicaid participating on the governing board, the Attorney General's office. The only vacancy that we have right now is from the Treasurer's office. Hopefully we'll look to fill that in the coming months. And then we also have public appointments that have been made to the board, including our colleague Janet Curry, who is the expert in human subjects research from Princeton, as well as a colleague from Montclair State and Camden Coalition, and then our privacy and security expert, Elizabeth Litton from Fox Rothschild. So the roles and the responsibilities of the governing board. So the project is established in but not of the New Jersey Department of Health. One thing we should mention is the commitment of the Department of Health, and thanks to Rachel's leadership and other colleagues at the Department of Health, there's been support. We're up to $1.8 million that's been allocated through DOH funding to support the planning and the implementation, the initial implementation of the iPHD. So we're very grateful for the financial support and the funding coming from DOH. The governing board has worked over the last couple of years to adopt and publish policies and procedures on privacy and security, data use and access, data retention. We've had research consultation with subject matter experts, and really been talking with our colleagues, our network of researchers across New Jersey. We've established research priorities, and we have identified the initial data sets, all of which the initial 5 data sets are coming from the New Jersey Department of Health. We felt that made the most sense because the project is anchored in the Department of Health, but not of, as I mentioned. But the goal, again, is to expand this to other agencies and to bring in other administrative data sets, beyond the New Jersey Department of Health. And those conversations have already begun, and we view that as iPHD 2.0. The governing board is responsible for overseeing and authorizing data receipt. We do operate the governing board does as a public body, which means, conflict of interest guidelines are in place, open public meetings, and then administrative procedures and public reporting. Next slide, please, Oliver. So what are the iPHD research priorities? we've identified initially 3 priorities back in 2019. The first one is looking at the opioid epidemic, informing New Jersey's integrated approach to addressing the opioid epidemic. And again, I should say that I believe most of the support from the Department of Health, from the funding, is really coming from the opioid response funding. So it made sense, obviously, that was one of the initial research priorities. Second priority is maternal and infant health, improving maternal and infant health outcomes. We know that's a priority for our state colleagues. We know it's certainly a priority for the First Lady with Nurture NJ. So, you know, that was a clear choice of adding to the research priorities. Our third priority was social determinants of health and assuring access to physical and behavioral health services and integration, addressing the social determinants of health. I think if you look at these 3, the last one is the sort of the broadest one that can be really allow for multiple research proposals to kind of slide into that priority. A year later, so those priorities were adopted by the board in March of 2019. Obviously, we know what happened in May of 2020, or excuse me, in 2020. So in the late spring of 20, we added a 4th priority, which was COVID-19 and public health emergency. So using these data to respond to not only just COVID-19, but any other public health emergencies. So a little bit broader than COVID-19. The initial data sets, as I spoke about a minute ago, where we targeted the 5 data sets really that are aligned to the 4 research priorities that I just mentioned. So these data sets obviously would be in play to be able to address questions that fall within the research priorities. The birth data, the mortality data, the communicable disease registry surveillance system. That is it is a surveillance database, so it has other disease reporting other than COVID, but for the purposes of this project, we will only be getting the COVID-related data out of the CDRSS. The 4th data set is the hospital billing data, UB data, uniform billing, and then the EMS data. I will happily report, thanks to Jose's efforts and working with Ed and our computing team, we have received the first push of data yesterday, the birth and the mortality data from DOH. So that was a momentous day. So we're happy about that. And now working on the next wave of data. So that's a bit of a flyby on the overview of the iPHD, and I'll hand it over to Joel to talk a little bit about the process moving forward, the application process and the review process.
Thanks. And I will say we will make these slides, if we haven't sent them out yet, we will send them out right afterwards. So no need to take notes. We just have a few more slides. And then we'll leave plenty of time for Q&A. So who is eligible to apply for and receive iPHD data? The answer is really any qualified researcher who's can propose research projects that align with the approved purpose and priorities that you just saw. So New Jersey research institutions, PIs from New Jersey research institutions will be eligible in this first year to apply for pilot grants. For those not eligible for pilots, which would be the whole rest of the world besides New Jersey, plus those who New Jersey-based applicants who don't successfully get approved for a pilot, the data can still be made available to them. There will be some data access fees that will apply. That I would say are at the moment not quite approved by the board, but they're looking like they'll be competitive with other data sources like this. This is a bit of expense to operate this thing. We have to cover our costs. Of course, students, we are interested in students applying. They'll have to demonstrate adequate faculty supervision. Everyone receiving data will have to comply with of course, all applicable laws, HIPAA and other things. And the iPHD policies and procedures, which are all on the website. There's privacy and security guidance. Nobody will receive data until we receive documentation of IRB approval. And the plan is to ship out only de-identified, minimum necessary in the HIPAA sense, data sets for the each approved project. So we'll create customized data for each project. We'll do the data linkages in-house and then ship out linked but de-identified data. We will be actively seeking a diverse pool of applicants, including researchers from underrepresented groups. The research consortium that Margaret alluded to earlier will be really a large push marketing campaign throughout New Jersey to bring researchers to the table to consider using iPHD data. So there's the website again with all the forms and guidance will be posted there. We at the center are charged with processing the applications, helping applicants fill them out completely, review for completeness, compliance with the rules. So here's where you come in. We will assign applications to RAC members to review. We will then collect those reviews and summarize them for the governing board, and we'll talk more about that in a minute. The governing board will then review and either approve or not all applications. So the final decision is theirs. As the name implies, your role is advisory. Once things are approved, let's go back, there you go. Once things are approved, we at the center will execute the appropriate data use agreements, prepare integrated data sets, provide technical assistance, and hound people for their annual reports, among other things. Next, please. So what exactly is the RAC? What are your roles? So far we have a panel of 34 experts. Some are chosen for their subject matter expertise, others for their research methods expertise, others have expertise in these particular data sets. Lots of you fill more than one of these categories, but it's I think a well-rounded group covering all of the research priorities. We will assign each application to at least 3 members of the committee. We're anticipating, at least for this first year, to have 2 review cycles, so they'll come in batches. We will provide an honorarium. I would not depend on that honorarium for your kids' college, but it'll at least be a token of our appreciation. As I said, we'll collect the reviews and write up a summary statement for the board. The reviews themselves will be available to the board as well. So each application, you will be asked to comment on each application and its alignment with the approved research priorities, the qualifications of the applicant, the validity of the methods. Can the data do what they're saying they want to do with it? Will be a big important question. For example, are their methods going to be scientifically sound? The board will consider the comments, but then they'll make their decision. So this is modeled to a great extent. You can go on to the next slide. This is modeled to a great extent on the NIH study section process, with the big exception that there's no study section meeting. So your role, you'll each independently review your assigned application, and then it goes to the board. So there won't be a discussion meeting. So the review criteria also look like an NIH application process. We'll ask you to comment on significance, qualifications of the investigator team. Do they need to add a statistician? That kind of question. Their research approach, and is their research environment, is it adequate? You'll note, for those of who are into the sort of NIH world, you know, innovation's not on the list. We've folded that in with significance, rather purposefully, because the goal here is, of course, we're interested in advancing science, where innovation is so important, but we're mostly interested in improving population health in New Jersey. So it may be that somebody's proposing a replication of a study done elsewhere. And to do it in New Jersey, maybe that wouldn't score very high on innovation, but significance might be very high. So we have also adapted conflict of interest guidelines from NIH, in some cases strengthening them, but also acknowledging that we have a lot of people from Rutgers on this panel. So we can't ask folks to recuse if there's somebody else in the institution applying, but we have what we think are strong guardrails to make sure that conflicts don't come up. And I'm not going to go through the fine print here. We will share it with you in the slide deck. So I don't think we need to go through it in detail now. So why don't we go on? So where are we in the timeline? So in January 2022, we'll receive our first data we have. And our team, Ed and Jose and others, are preparing the data for integration and linkage, and bringing the documentation up to standards. DOH has very strong documentation, so it's not a heavy lift. And start preparing data to ship out to researchers. We'll host the research consortium meeting in May. It will, in essence, be a bidders conference for the pilot grants. So we'll announce the RFP for the pilot grants at that time. And then in June, we'll start taking applications. And so your work would begin the June-July window. We've purposely selected a large group of reviewers. So if you're busy and you can't do it, we'll find somebody else. This is not intended to be a great burden for you. You'll find the applications are pretty streamlined. The review process pretty clear, I hope, and streamlined. And then we hope to start shipping data sets to people late summer, early fall. That's it for now. So why don't we turn the slides off and open the floor for any questions. Go ahead. Yeah, we're a small group, so just speak up.
Oh, great. So this is really exciting, both from a researcher's perspective as well as from the other side in terms of sort of having a little bit of say in terms of which projects are innovative, well, not innovative, but which ones are significant and really overlap with the needs of the center. So a couple of quick questions. I mean, these are just logistical type questions and they're probably answered on the website already. In terms of the lead time, what do you anticipate in terms of the lead time between when you receive the applications versus when reviewers will be asked to chime in versus submitting the review? And do we anticipate, is it on a rolling basis at some point, or is it 2 cycles every year in terms of what the anticipation is for proposals going down the line?
Yeah, so some of those things are still a little fluid, and we frankly haven't thought about the turnaround time that we'll be asking for yet. So thank you for raising that. We will commit to giving you plenty of forewarning for when things might be coming your way, and then adequate time to respond. I know that's not a really satisfying answer. You know, the goal here is not to be burdensome, but to sort of get this done in a fairly expeditious way. Our initial thinking is that we will do this in cycles, and certainly for the pilots, they'll all be due, the applications will all be due at once because we'll have to do triage among them. And the board will have to decide which, you know, if we have 4 pilots and 30 applications, the challenge is obvious. Other applications for data only are really non-competing. Either they meet the bar or they don't. And so initially though, I think we're going to have deadlines and batch things just for efficiency of processing. But, you know, we will, you know, learn as we go. And if it turns out rolling application processes is more efficient, we may switch at some point. Initially, again, thinking that we'll have 2 deadlines a year, but that may not be sufficient, so we could increase them. Also, we didn't mention that this is, you know, this is iPHD 1.0, and we are already in conversations about adding additional data sets in future years. And so, you know, as the scope grows, so will this review panel, and the process will evolve accordingly.
And I think one of the advantages of having such a deep bench is that we don't anticipate a reviewer reviewing more than a couple of applications. So we, can avoid the burden on all of your time. And I think again, the administrative burden, obviously you do the review, but all the write-up, and we'll take that on our side in terms of packaging and presenting to the governing board. So, but appreciate the question.
So am I correct in understanding that the application and the review process are the same for the data only requests as for the pilot funding?
I think they're they're virtually identical, if not identical. Obviously, for the pilots will ask for a budget. We won't for the others. But other than that, it's pretty much the same.
This is Bretta. Can you explain a little bit more about the process with IRB approval, and then where the RAC members will then be reviewing cases about the validity of the science, and also whether or not the data that they're requesting will help them answer the question that they're trying to ask? I was under the impression that in order to, like a chicken and egg, like which is supposed to come first, like the IRB approval and then knowing whether or not the data will answer the question, or do you need to really have a handle on whether the data will answer the question before you should be requesting IRB approval in the first place?
Yeah, and so the IRB approval will come from the investigator's own institution IRB. So it's a little different than the DOH process where everyone goes through the Rowan IRB. So the process will really follow what their own local institutional guidelines are. And we didn't want to be overly prescriptive here. And Oliver, jump in if there's anything I'm saying that's wrong. So investigators will apply according to the timing guidance of their own IRB. The only thing that's sort of a hard line for us is that no data, no IRB, no data. So Oliver, anything to add?
No, that's exactly right. So Rutgers IRB has approved the application for Rutgers to manage the project. We are not conducting research. We are housing the data. It is left to the individual investigator, as you had mentioned, to apply to their home institution's IRB and present with their application a approved IRB protocol.
Right. They just need a federal-wide assurance number so that we know it's a federally sanctioned IRB.
Right. Well, the reason I ask is because I as being on the IRB from the Department of Health many years ago, as you may recall, I would see a lot of applications that were asking for department data, and they wanted to ask research questions that the data simply couldn't answer, and they didn't want to hear that.
Yeah.
So they would insist on keeping applying, and it's like our data is not responsive to your question. So I was just wondering if there was a way, if you anticipate that happening, and if there was a
Oh, I do, absolutely. And
all right.
It's why we're looking for your expertise, you individually, but you collectively, on whether the data support answers for the proposed questions. So I'm sure we'll have folks who don't agree with us.
Are you expecting that, like, based on feedback from RAC members, if there is something about the question that they're asking of the data, do you anticipate being able to go back to them and say, these were some comments, and then if they want to change their application for data, they would maybe, redo their own IRB approval process? You expect that's going to happen too?
Yes.
Okay.
Yeah, so this isn't, one and done. If we at the center feel the application doesn't check all the boxes, or if the board feels or RAC member feels it's not ready, we'll give people feedback and let them revise and resubmit.
Okay, cool. Thank you.
I think the other point, Brett, is that in addition to the IRB approval, we'll be executing a data use agreement, as I think Joel had referenced at some point. So we do have, Rutgers has a DUA with the Department of Health to move the data. And we have now a draft agreement that will need to be executed with each researcher who receives a data set. So that's the other document that needs to be, she's got the motion lights too. So that's the other agreement that needs to be in place. And I would just say one of the things, Bretta, that we're thinking about, as Joel said, the goal here is to try and accommodate as many proposals and requests for limited data that we can. Obviously, we want the rigor of the analysis. We want the standards of the proposals to be high. But aside from the competition, if you will, for the pilot funding, our goal here is to get the work done and to accommodate and to be able to supply as many research requests as we can. The one thing that candidly is just a little bit of a black box for us is what the volume is going to be coming in for the proposals. So I think our intent is to provide as much technical assistance and guidance as we can to get these proposals to the point where they are competitive and that they answer the right research questions with the data set. But a lot of that, frankly, is going to depend on what the volume is coming in. We think we have the staffing, we have contingency plans, particularly because one of the data sets is the COVID data. We're pretty sure we're going to be getting a lot of applications. So that may be the one. That's a variable that I think will depend on how much we can lean into these interactions with the applicant. Our desire is to kind of work with them and provide some guidance so we can have resubmission, but just logistically, I think we're going to learn a lot from the first round in terms of the resources that we have relative to being able to maybe go that extra mile in providing some guidance and assistance.
Other questions at this point?
Question. Do you anticipate, or maybe you already have this up on the website, just a list of the variables that will be available in each of the data sets in terms of that might help people be able to figure out whether their research questions can be answered with the data?
So I don't think it's up there yet, but it will be shortly. Jose?
Yeah, and I was going to add to that. So yes, in addition, we're going to try and be as transparent as possible in providing sort of the list of data elements available for each of the data sets, and to whatever extent allowable, even perhaps percent missing on certain data elements that may help answer some of those questions or for that researchers may have. Can I answer this question based on the data that's available? So to whatever extent we're allowed to, and then we can be transparent on the website, or even if it's, if they're reaching out beforehand to asking questions in advance about the data, we will provide that information.
This is Loretta. I guess, will the program that's the manager of the data, will they be notified that, their data has been released for an IRB approved project?
Absolutely, we could. We should probably just add that to our workflow. Folks want to know, of course, we'll notify them. There are some reporting requirements that are part of this. Annual updates and sort of summaries at the end of projects, and those we most definitely intend to share back with the data stewards and the agencies. Yeah.
Especially for grant funded data, knowing how the data is getting used is really helpful in talking back to funding sources, like that the data that we're collecting goes out. So if that's something that we could get, like that would be great.
Absolutely. Yeah. We're all for funding.
Yeah.
And I just want to add that that was one of the initial goals of the iPHD project, making sure that this sort of is in the best interest of the state. So anything that is provided through the iPHD project comes back to inform the state. So that was one of the, I know, in the initial goals in starting this way back when, it was very important, and sort of everything has to be done in the interest of the state.
And providing springboard for additional funding to come into New Jersey.
Right.
A couple of questions. This is Soko. So in terms of, applicants, they might come to the data and say, like, we want to use this data for NIH funding or other source of funding, and then often that requires some preliminary data. Is this also providing some function to provide some preliminary information for those who might want to apply for funding to use this data?
So this question actually came up in the earlier session. And we don't have a provision right now, but we hear the need. So this is for example, if somebody wants to study, condition X, they need to know how frequent, what the sample size is in the data set. It's probably fairly straightforward to do that. If it requires novel data linkages and other things, then there might be an expense associated with it. But we'll take that back and consult with the board about the most efficient. And we want it to be rapid and either free or very low cost.
Makes sense. And then the other question, as I understood, as Joey, as you said, that the data will be shipped to who requested once it's approved. Are you intending to cut the data for the sort of study, or it's more like a whole data set going into this?
No, it's going to be study specific data cuts.
Okay.
We will permit reuse for other studies, although it'll require a new application. It won't require all the fees to cut the data set again, but there'll be some fees associated with it. I think that covers it.
Yeah, I think that's more like a CR registry, CR Medicare model, where you cut the study specific data and allow, within a certain time frame, but it still requires the application for the new reuse. And then the other issue is you have probably already set how they have to destroy the data once, project is completed and stuff like that.
Yeah, that's all in the policies and procedures and will be in the DUA.
Okay.
It'll be pretty standard, research conventions for that sort of thing.
Makes sense. Thanks.
I will, you're correct that we're thinking that we'll be shipping data sets out to people if there are organizations that don't have the capacity to securely analyze the data. Our parent institution, the Rutgers Institute for Health, can support people to use our platform. Soko, as you well know, it's very expensive. And
in certain organizations, and then certain organizations actually do it quite reasonably. So it really depends on the model.
Yeah. So we'll be as flexible as we can be with the only thing that is not negotiable is that the data have to be properly secured.
Makes sense.
And we are asking when they execute the data use agreement that they attach their data management plan and their security plan. So
yeah.
Unfortunately, there's going to be some paperwork involved in this, but as researchers, we're used to that.
Yeah.
Other questions? Okay, well, thank you all for joining us. The slides, if they haven't gone out, will go out to you.
Did go out. Yeah, they did.
They did. Okay, so you have them. If any questions occur after we're off the air, please send them along, and we will be in touch with regular updates as we progress toward launching the application process.
I would just add to Joel that the other packet that was attached, it had the agenda, but behind all that was the scoring sheet and the application, if you wanted to take a look at that. So you have a flavor for what it's going to look like.
Right, and if you have comments or suggestions, this would be, send them along. Great.
Thank you, everybody.
Thanks, everyone.
Thank you.
Bye-bye.
Bye.
Looking
Bye.
forward to it. Bye-bye.
Thanks, Minna. Bye, Minna.
Bye-bye.